Hey, what's going on? It's Ian Hart here, backpainreliefforlife.com and Back Pain Relief for Life expert. And today I'm going to speak to you about crunches and back pain. And it doesn't have to specifically be crunches, because really what I'm speaking about is spinal flexion. And spinal flexion occurs when you do sit-ups, crunches, if you bend over improperly without hinging at the hips. So any type of repeated spinal flexion, all right? Specifically, I talk about crunches because a lot of people are still doing crunches nowadays. They're doing them wrong. They don't have enough core strength or core stability to be doing them in the first place. So again, repeated spinal flexion. The spine, first off, only has so many flexions in its system before the discs start to wear out. Everybody is going to degenerate their discs at some point. It comes with age. Everybody above the age of 50 has been researched and shows that they have disc degeneration. So no one is free from that. If you have been done more and more spinal flexions, your degeneration is going to happen much more rapid. So first off, again, we want to limit the amount of spinal flexion, but it also strains the weak points in the back. When you do crunches, you're putting stress right on the area that most people are having pain. Over 80% of the population is suffering from low back pain. There's some extremely important nerves right around L4, L5 in the lower back, and a lot of stress is put on that when you do spinal flexion. It can cause the disc to bulge, and it can also cause leakage in the disc. So in the disc, it has a nucleus that is this like mucus-like, kind of jelly-like form. And when you do spinal flexion, it can cause that disc to bulge, or it can cause leakage in that nucleus, which is the cushion, soft stuff that really protects your joints and cushions any jarring movements in the body. When you see that degenerate, you can start to see pressure on the nerves, which creates pain, and it can cause more issues later on and prevent you from moving properly and feeling good and a lot of other things, a lot of other issues. Again, it causes faster degeneration. So let me just show you real quick what spinal flexion is. Spinal flexion would be moving hunched over to pick something up, and all the stress is on your lower back. The proper movement would be pushing the hips out, keeping the back straight, and squatting down. So moving from the hips. Right now I feel my core is nice and tight, my lower back's nice and tight. I'm not opening up my lower back for injury. So that's part of the solution, what I just said. You want to bend at the hips. So hip hinging. A lot of people nowadays we see come into our place where we fix their back, and they can't even hip hinge. They don't even know how to do that. That pattern has long been broken down and they can't even move. They only move at the spine. And this is the area that has severe pain for the most part, which is why they come and see us. So we have to recreate a new pattern for them to move at the hips and stop spinal flexion every time that they go to pick something up or get out of the car or twist. When you start twisting with spinal flexion, that's where real trauma can begin and real pain starts to set in. Core exercises. So a lot of people think crunches, sit-ups, that's core exercises. Core exercises are actually much larger movements that are going to engage your abs while you do the movements. For example, I'm sure most of you have heard of planks, where you're in a position, abs nice and tight, your feet are touching, your elbows or your hands are touching the ground. Well, you can go beyond that and do a push-up. A push-up is pretty much a moving plank. So when you have your kinetic chain in the proper position, and you move throughout that push-up motion, you're engaging your core, you're engaging your lower back, you're engaging your glutes, you're engaging your abs, and you're engaging the whole kinetic chain that's going to strengthen the muscles around your lower back. You also have squats and deadlifts. Those are core movements. Those are going to help you strengthen your core and protect your spine. Again, you want to make sure that you're moving properly. So I suggest always seeking professional help, because many people don't really understand kinesthetically how to move properly, and you can end up doing more damage, especially if you had back pain and you don't know how to move properly. Also, we have a specific program called Back Pain Relief for Life, which we designed specific for people who have an SI joint issue or that hip issue where they can't mobilize at the hips. And we find that getting hip mobility and being able to hinge at the hips can not only help your back pain, but eliminate hip pain, thoracic spine, which is mid-back pain, neck pain, knee pain, and really it affects your whole body because these major nerves down here transport nutrients, oxygen, blood flow to the rest of the body. So if you feel like you need some help with your hips, go ahead and check out backpainreliefforlife.com and see if that program's correct for you. And stay away from crunches. Make sure you're doing core exercises and you know you're engaging your abs while doing the movements. This is going to protect your back for the future and reduce the degeneration of your discs and save your back for the long term. So this is Ian Hart, back pain relief expert and co-creator of backpainreliefforlife.com.